Welcome back. You're watching Brass Tacks. We might like to believe that COVID-19 is past us and the world has come back to normal, but the alarming situation being reported from China is clearly worrying. With high number of cases and casualties being reported from the epicenter of COVID-19, Health Minister here in India, Mr. Mansukh Mandavia, has sounded an alert. The Health Minister chaired a meeting to review the COVID preparedness. He also assured that the Union government is prepared to deal with any kind of situation. Well, not just here in India, but the United States has also raised an alarm over the possibility of new mutations. With reports of hospitals being overwhelmed, crematoriums being burdened, which are coming from China to light. Remember, this surge is a very, very worrying pattern. A surge in cases and deaths in China was reported as country eased out of its zero COVID policy earlier this month after the protest took place. What does it mean for India? How prepared are we? That's our focus.
Cars waiting to get into that cremation area. There are many security guards patrolling this entire area. And I spoke to a man earlier who said that his close friend passed away from a fever, though the hospital didn't say why. He said he's been waiting here for hours.
नॉर्मल लाइफ लीड करिए, कोविड अप्रोप्रिएट बिहेवियर रखिए, सिम्टम आते हैं टेस्टिंग कराइए और प्रिकॉशन डोज लगाइए.
Well, joining us on the broadcast is Dr. Isaac Bagoch. He's an infectious disease specialist from the Toronto General Hospital. Dr. Ankita Baidya, who's an infectious diseases specialist, is also joining us on the broadcast. Dr. Naresh Chawla, who's the National Joint Secretary of the IMA, is also with us on the broadcast. Dr. Chawla, I'm coming to you first. How prepared is India and what's happening in China? What kind of message does it send for India? We have seen this pandemic for more than 2 years now. How prepared are we?
Listen, a few ground realities. Number one, just imagine just 2 days back, the thing was not on the media at all.
Sure.
And within 2 days, everything seems to have changed. So let me tell you, the ground reality is nothing much is changed. No doubt, we are seeing news of overcrowded cemeteries and crematoriums, and the media is blaring here and there. Too many things. But as far as our India is concerned, so let me take a very realistic attitude.
Sure.
We are also panicking. So my consolation to all my countrymen is kindly do not panic. We must not forget the few ground realities. We have had more than 200 crore vaccinations done. We suffered a lot during all the first, second, third wave, etc. And we got a lot of natural infection, which must have given us good immunity. Number three, since we were already immunized by BC, etc. things, so we already were good enough. And we Indians as a race have done fairly well. So do not feel overwhelmed, and the people do not have to be panicky. Even the government, be it central government, state governments, district administrations, do not be panicky. But only one ground reality that we must take all the minimum corona precautions, corona appropriate behaviors, use of a mask. Believe me, I practice in Delhi NCR. There is not even 1% use of mask. Not even 1%. So we have to go back to our corona protocol. If we do that, we follow the principle of social distancing and minimum of hand wash and hand sanitization and our own good eating and good immunity. I'm sure we protect ourselves against corona, also against the impending flu and currently occurring flu all across Delhi. We are the patients, the doctors who are seeing patients in hospitals, dispensaries, clinics.
Yeah.
We are seeing too many cases of flu.
Well, sir, the guards were clearly lowered down. I mean, the mask protocol is hardly followed. The mandatory masking has also been done away with, keeping in mind that the cases had fallen in Delhi and in other parts of the country as well. Andrew K.P. Leung is also joining us on the broadcast, who's an international and independent China strategist. Andrew, I want to understand from you how alarming the situation is right now in China and how cautious should the world be? I mean, I agree with the experts here that this is not the time to panic, but we must have a realistic account and assessment as to what is to come, because it starts in China and that's how it goes to the rest of the world, including India.
Well, it's been 3 years since China exercised this very strict lockdown protocol. And so far, China has been doing reasonably well in managing the pandemic, according to a recent study by New York-based Elderman Trust Barometer, EDELMAN, Elderman Trust Barometer based in New York, which look at countries around the world as to how they people feel their government managing the pandemic. And China came up tops. That was the January 2022. But now it's been 3 years, and people's patience is wearing thin. And meanwhile, the pandemic is changing into morphing into endemic. In other words, becomes just one of a very common disease people have to live with, like a very severe case of flu. And this is happening all over the world. I mean, if you go to the United Kingdom and you go into the United States, and governments are no longer reporting on these cases because, you know, the Western governments simply chose to live with the virus from the very, very early stage. But the cost is that if you live with the virus too soon, then the number of death cases have built up. For example, the United States have suffered more than 1 million deaths. If China, followed the same protocol, China's population is 4 times as large, and then the medical facility, the system is not as advanced, and there are many more vulnerable groups, then China would have suffered many, many more deaths. But I think that overall, China managed it quite well. But then the sudden relaxation have caused a great deal of alarm amongst the population. Because they're not used to it, and they're now required to self-test, and some of the tests are not reported, and some are. So the government is no longer reporting on these cases like any other country.
There's one more thing I want to know. Are the Chinese sharing information and reporting facts with honesty? Because China has concealed information, and that has not worked in the interest of world health. Right now, with the kind of surge and the cases which are being reported, information sharing by the Chinese is very crucial. That's what the WHO also said today.
Well, I think that in the beginning, when the virus first happened, reported in Wuhan, there was a bit of a hiccup. But very quickly in January, don't forget, in January 2019, I believe, 2020, 2020, in January, China, make the cases, reported these cases to international peer-reviewed journals, sharing the DNA and so on and so forth. But a lot of countries did not take heed. For example, the United States laughed at this of this virus, resulting in upsurge. But now, as I said, now the virus is more into an endemic, and like many other countries, China can no longer report on these cases because the rigid protocol is no longer exercised, and people just self-testing themselves. Some are not reported, so there's no point in reporting this information, which would be highly misleading.
Well, WHO says that they've just put out a couple of tweets on the social media, and they said that we need more information coming in from China. Dr. Isaac Bagoch is also joining us on the broadcast. Doctor, coming to you, how do you view the situation in China right now, in multiple cities of China, in Beijing and other parts, especially with the hospitals overcrowded? Is this something that can be controlled locally? Because whatever we know of COVID-19 in more than 2 years, so far dealing with the pandemic, it starts somewhere and then it starts going to different countries. Is that the trajectory which is likely to happen even now? That's what the world is scared of.
Yeah, I think the bigger concern would be what's going to happen within China. And obviously, we just wish everyone well. We don't want to see anyone on the planet harmed by this virus, including China. But unfortunately, they're going to have a large wave. I would remind people watching this that obviously we know that the vaccines are very helpful in terms of protecting people against some of the more severe manifestations of the virus. But it's extremely important that that people get the vaccines and, of course, get booster doses of vaccines. Unfortunately, some of the information we're seeing from China and some of the data we've seen emerge from China is that many people have not been vaccinated, especially older individuals and individuals who might be at greater risk for more severe infection. Even if, and the other important point too is that China has seen very little at a population level in a manner of infection relative to other countries on the world. So they don't have the same degree of what we would call hybrid immunity that other countries have. I'm not saying it's good to get infected, the opposite. I'm just saying we just can't ignore that hybrid immunity from infection and recovery from infection coupled with vaccination provides more robust community level protection. Sadly, China doesn't have that. And they're going to see, and they're already seeing, a very large outbreak. One other reminder is that we saw this play out in Hong Kong earlier when you had an under-vaccinated older cohort of individuals. And for a period of time, Hong Kong sadly had one of the highest rates of death on the planet. So I think China obviously needs to work very hard on ensuring people are vaccinated and boosted, especially older, more vulnerable communities.
Does it set for the rest of the world? What kind of alarm bells does it set for the rest of the world?
You know what, in all fairness, yeah, sure, having 1.4 billion people sadly exposed to this virus can certainly help facilitate or increase the likelihood of more mutations and more variants developing. But in all fairness, too, to date, the vaccines have done a remarkable job standing up to protecting people against more severe infection like hospitalization and death. Not as much as before, protecting us against infection and onward transmission, but protecting us against hospitalization and death regardless of the variant. Ancestral strain, alpha variant, delta variant, Omicron variant, various sublineages of Omicron. The vaccines have done a remarkable job with protecting us. So it's time to get those vaccines out.
It's time to get those vaccines. It's time to get back those protocols that have been done away with, like it was being pointed out by Dr. Naresh Chawla. Dr. Ankita Baid is also with us on the broadcast. Dr. Ankita, coming to you, when it comes to COVID protocols, of course, all of us have lowered our guards. We have seen that the mandatory mask mandate has been done away with. Social distancing is not being followed. And that was perhaps the right response in those circumstances when the COVID cases had really come down. With the present reality and that variant traveling to India and to different parts, what kind of preparedness do we really need to have in place? And considering our vaccination rate and the success of the vaccination program, how prepared is our country?
So we need to learn, Anusha, what was not there in the second wave. We had less of hospital beds, we have lack of oxygen supply at various levels. And that actually we suffered a lot in second wave. So if we have taken learning lesson from that, so we need to upgrade our systems. Now, again, recheck whether all the oxygen plants are at place or not, if at all the hospitalization is required. Apart from this, if I see that the statistics that is being coming, that only 27-28% of our population is being vaccinated with precautionary dose, I am little worried about this. I feel what we had seen with the Omicron variant, this year we had milder cases, not much of hospitalization, and yes, gatherings are going on. Everything is back to normal. We see closely what is happening in the society, where everything is very close to back to normal. But the figures that vaccination, usually it's recommended in India that every 9 months you need to take booster dose. That is lacking. The percentage of precautionary dose, the people who got this vaccine is less. So I am worried. I appeal everyone, go for your vaccination dose. As Dr. Isaac also rightly mentioned, that this vaccine might not prevent you just from infection or the transmission, but it will help you to prevent against hospitalization and getting a severe form of COVID. So go for your vaccination, especially elderly population, people with comorbidity who are at risk of getting this infection. Go for your vaccination dose. So this is very important.
Dr. Chawla, the issue of waning immunity and the need to get booster doses, especially for the vulnerable population, the elderlies, people with comorbid conditions. Once again, the basics of 5W1H, how we had tackled COVID-19 earlier, all those protocols need to be brought back.
Let me share one thing very frankly, that scientifically and medically we know, but we don't acknowledge it, that the virus is weakening. Don't forget, after the second wave in 21 April, May, after that we heard of many waves coming, but all those viruses variants were less lethal, they were more virulent, they were more infectious. But down the line in clinics and dispensaries in hospitals, we saw lots of cases, but we did not see much deaths. And I'm sure I agree with my co-panelist that the virus from becoming after having been a pandemic, it has been reduced to endemic. As I must share that as we used to have viral fever or flu or influenza in India, we will have it as an endemic only. So there is, just imagine, from yesterday to today, I have appeared in almost 9 television interviews and none in last 6 months on corona. That means that is the kind of panic reaction even the polity is showing, even the media is showing. So I like to put the record straight.
Dr. Naresh Chawla, most politely, I mean, I think the reaction is not so much of a panic. The reaction is coming in from the lessons which have been very hard learned, and you're the doctor at the front line, you would know it better than me. The painful losses that families have suffered, and we don't want to repeat our mistakes. And I think it's only in the larger public interest that we reiterate through doctors like you that wear your mask, wash your hands. If you have not taken your booster shots, please take them.
I'm coming down the line, that only. The word COVID-19, tell it to anyone. Has it come back? So that word frightened for 3 long years. Don't forget, in an authoritarian society like China, the people protested. The people fought with military. So what I'm trying to say is we must gullet down only that kind of advice which is acceptable to people. Those acceptable advices, on one side, the national government, state governments, district administration must maintain a vigil, must maintain a preparedness.
And that's what the health minister has also said. Andrew K.P. Levy, I'm coming back to you. And I reiterate the point that I was making earlier, that the World Health Organization has said that more information needs to come in from China so that the world can be better prepared. There are better precautions that can be taken. While you're saying that the Chinese are making efforts to contain this, internally, and, perhaps the entire world won't be jeopardized by it, but the kind of images that have been coming out of crematoriums being unfortunately flooded, hospitals being overcrowded, it does look like a very alarming situation.
So I was saying, sorry. Yeah, please.
Yes, Andrew, please go ahead.
Sorry, as I was saying at the beginning, there was a initial panic of the Chinese population not getting used to a sudden, completely, abandoning all these strict measures all at once. And then people are expected to self-test. And then if you self-test, and obviously people find that, they've been infected, but in fact the infection doesn't necessarily mean any severe kind of impact, because most of these cases are asymptomatic, and then if they get affected, it doesn't mean
I'm sorry I'm interrupting you, but there's a US-based Institute of Health Metrics and Evaluation, IHME. It has made a forecast of about 1 million deaths in China that could face an explosion of COVID-19. How do you see that?
Well, I think that estimate is really over the tops. It's not based on science. It's based on just a sort of mathematical projection in a different environment. I mean, look at China. I mean, as I said, with their own vaccines, and they've managed to keep down the death rate, sort of multiple levels below the United States. The United States has suffered over 1 million deaths, and China is no way near that number, even though China's population is 4 times as high.
Well, I only hope that we don't want this unfortunate situation to emerge in any part of the world. And this is the time for countries like India and for the rest of the world to go back to the basics, wear your mask, follow your hand hygiene, make sure you take all the precautions. And the government of India says that we are well prepared to deal with the situation. I thank all of you for joining us on the broadcast. When it comes to COVID-19, we cannot let our guard down. With that, it's a wrap from my side. Ridhima joins you with the News Epicenter.